Hello, and welcome to the presentation on high-risk medication preparation and administration during an emergent situation. We are doing this education because Advocate Sherman is establishing a new practice change, and we are going to implement it in critical care. So here's the why. In 2021, critical care had a safety event where a paralytic was delivered during an emergent procedure instead of a flush. Labeling syringes with dosage and medication name has been found to be best practice. Currently, Advocate Sherman does not have a standard practice to label syringes that have been drawn up during an emergent procedure, so critical care will now start doing this. Also, verbal orders are generally given during an emergent procedure, especially during an RSI. Best practice includes using a closed loop confirmation of the verbal order, and we have strayed away from that practice a little bit. So here are the course objectives, and I will let you read through those. So in our rapid sequence intubation kit, we have a bunch of medications. We have atropine, etomidate, fentanyl, ketamine, midazolam, phenylephrine, propofol, rocuronium, and succinylcholine. You can see that everything listed here in red are medications that come in a vial, and these are the ones that must be drawn up and will need to label. The atropine, ketamine, phenylephrine, and succinylcholine already come in pre-filled syringes that already have the medication name and dosages written on them. These are the crash cart medications, and we've included this simply because amiodarone does come in a vial. You can see it's the only one in the crash cart that comes in a vial. And so if you are drawing up amiodarone, we will have labels in the crash cart to label an amiodarone syringe as well. But that is the only thing in the crash cart. Everything else is a pre-filled syringe. So here we have listed all the sedatives in the RSI kit. So you have fentanyl, Versed, ketamine, propofol, and etomidate. And these are the paralytics in the RSI kit. So you have rocuronium and succinylcholine. And you always want to make sure that you're pushing these after you push the sedative. Okay, so next we're going to talk about assigning roles during an emergent procedure, and more specifically an RSI or a rapid intubation. So in an emergent procedure, a medication preparer role should be assigned. There should be one person in this role, and that person needs to make it known to the ordering provider that they're the nurse that will be preparing the medications. This RN will have the RSI kit or will be near the crash cart for quick access to the medication drawer. So this is where we're going to start talking about accepting a verbal order. So there is a chain of events that should happen when you're accepting a verbal order. First, like I mentioned before, you should let the provider know that you are the medication RN. You're going to be the one accepting the verbal order from that provider. Next, you're going to listen for the specific verbal order from the physician. Then you're going to repeat back the verbal order to the ordering provider, and most importantly, you're going to listen for verification from that ordering provider that the verbal order is correct. That's going to close that closed loop of communication. So here's an example of accepting a verbal order. So the nurse is going to start out by making sure the doctor knows that they're the person that will be preparing the medications. So we have, as an example, Dr. Milas, I'm going to be preparing the medications. The doctor should then respond with your order. So in this case, the doctor says, great, please draw up 20 milligrams of etomidate and 50 milligrams of rocuronium. So this is where the nurse is bringing that closed loop by saying, okay, I heard you order 20 milligrams of etomidate and 50 milligrams of rocuronium. And the most important part is waiting for that verbal confirmation from the doctor that your readback is correct. So here's where we get into labeling the medications. So you've gotten your orders, now you need to draw them up. So pharmacy is now going to stock these labels in the RSI kit, and they will be color coded. So the paralytics will be red labels and the sedatives will be yellow labels. So you can see on the left set of arrows, the 10 milligrams per mil, just note that that's the concentration of the medication. It's not the dosage in the syringe. You'll see I put little circles where we're going to take a Sharpie or a pen or whatever to write the dosage that was drawn up in the syringe in that area. So this is what we want the syringes to look like. The labels are short enough that you can wrap it around the syringe, like the picture on the left, without obstructing any markings on the syringe. So the picture on the right is actually that same syringe, just flipped over, so you can still see all the markings. That way we can ensure that the dosage is going to be correct. So now that we've got the syringe drawn up and labeled, we're now moving on to administering the medications. So the doctor will tell you how they want you to push the medications. You'll want to obviously make sure you have a patent IV line and not something that will blow when medications are being pushed fast. Always remember, again, that the sedative is pushed before the paralytic so that the patient is asleep before we paralyze them. And then orders for the medications can be entered into Epic and back-timed accordingly after the emergent situation. So you're going to want to make sure that you save the vials so that they can be scanned into Epic later. So now the fun part. So everyone in critical care is required to be validated on this practice change. So in order to do that, you have two options for validation. You can do an evidence of daily work or a return demonstration. An evidence of daily work includes a PCL watching you during an actual rapid sequence intubation, and if you do everything correctly, they can check you off on a checklist. If you don't have an opportunity to be a part of the rapid sequence intubation as the medication preparer and administrator before the deadline, then you can do a return demonstration. So that is going to include you being validated in the education room with a PCL sometime during your shift before the deadline. The new education room is that little room next to the nourishment room on the critical care A side where the intensivist office used to be. So it's going to be up to you to seek out a PCL to get validated before the deadline, which is August 31st. So here's the first part of the checklist, and I will send an email with an attachment of this checklist so you can print it out and look over it before you get validated. So the first section we have is the high-risk medication identification. So we're just going to want you to name a few paralytics and a few sedatives that are in our RSI kit, and then the medication that has to be drawn up from the crash cart, which is only amio. Then we're going to have you demonstrate a verbal medication order with the closed loop communication. So you can read through what we're going to want you to do to meet the points of the checklist. Your PCL is going to act as the ordering provider and you're going to act as the RN. So you'll just do exactly what we said. Alert them that you are the medication preparer, receive the order, repeat it back to them, and wait for that verification that the order is correct. So moving on in the checklist, we have our last two sections, which is going to be our medication preparation. So you're going to have a vial and a syringe that you're going to be drawing up the medication and labeling the label correctly, and then placing that label on the syringe correctly, again, just so that it's not covering up any markings on the syringe, and then cross-checking the syringe and dosage with a second nurse, which will be the PCL in this return demonstration. So that is it. If you have any questions on the new process or the validation process, feel free to reach out to me. I put my email on here. And I look forward to hearing from you and seeing everyone get validated by August 31st. Thank you.